So today, we're going to dive into the really complex world of inflammatory bowel disease, or IBD. And we're going to do it by following the real-life case of a patient, we'll call him Alex, to see how doctors figure out and treat this incredibly challenging condition, really from the inside out.
Our story kicks off with a medical mystery, a battle that's happening inside a perfectly healthy 30-year-old man. You can almost think of it like a civil war, where the body's own defense systems have, for some reason, declared war on itself.
I mean, what a terrifying question, right? For millions of people out there, this is not a hypothetical. The immune system, the very thing that's designed to protect us, can sometimes go rogue and launch this sustained, brutal attack on our own tissues. And that's really the fundamental problem behind conditions like IBD.
So let's meet Alex. He's got no major medical history. But then, over just 3 weeks, his entire life gets turned completely upside down. It all starts with this cramping pain in his abdomen, which then just escalates to 5, maybe 6 bowel movements a day. He completely loses his appetite, and eating just makes the pain so much worse.
And wow, this number really shows you just how severe this thing was. 20 pounds. Alex lost 20 pounds in only 3 weeks. This was definitely not just some minor stomach bug. This was a huge red flag that his body was in some serious trouble.
So, with Alex getting sicker by the day, his doctors had to move fast. They needed to get past the what, the symptoms, and figure out the why. They needed a diagnosis. And the main suspect was inflammatory bowel disease. But here's the thing, IBD isn't just one disease. It actually has 2 very different faces.
Okay, so the first clues pop up in his blood work, and these numbers, well, they're basically screaming that something is seriously wrong. His hematocrit and hemoglobin, which are all about red blood cells, they were dangerously low. That's a clear sign of anemia, probably from internal bleeding. At the same time, his white blood cell count and his ESR were through the roof, and both of those are key markers that tell doctors the body is fighting a massive inflammatory battle. The data was crystal clear: severe inflammation.
And this brings us right to the main suspect, inflammatory bowel disease. To put it simply, IBD is a case of friendly fire. For reasons we still don't totally get, the immune system mistakes the good, normal stuff in the gut for a threat and just launches this full-scale, never-ending assault.
But which type of IBD is it? Well, on one hand, you have ulcerative colitis. That's only in the colon, and the inflammation is continuous and pretty superficial. But Crohn's disease, that's a whole different beast. It can pop up anywhere from your mouth all the way down to the rectum in these patchy areas called skip lesions, and the inflammation can burrow right through the entire wall of the bowel. And figuring out which one it is, that is absolutely critical for treatment.
So to get the final answer, doctors had to actually look inside. An endoscopy showed this classic cobblestone pattern in his gut lining. And crucially, they saw diseased areas separated by perfectly healthy tissue. And those are the skip lesions, the smoking gun for one specific diagnosis. The verdict was in. Alex has Crohn's disease.
Okay, so they have a diagnosis. But now comes the really tough part. How do you treat it? In modern medicine, doctors face this fundamental strategic choice, a real fork in the road that's going to decide Alex's entire treatment plan.
And that choice is between what's called step-up and top-down therapy. The step-up approach is more cautious. You start with safer, less powerful drugs, and you only move up if you absolutely have to. The top-down approach, that's aggressive. For high-risk patients like Alex, you come out swinging with the most powerful drugs right away to get the disease under control fast.
You can think of the step-up path kind of like climbing a ladder. You start on the first rung with drugs called 5-ASA compounds. If that doesn't work, okay, you climb to the next rung, a short blast of powerful anti-inflammatories called corticosteroids. And only if that fails do you move to the top of the ladder with the really heavy-duty stuff.
The top-down path, on the other hand, the one for more severe cases, is the complete opposite. It's like taking an express elevator straight to the top floor. The goal is to hit the disease hard and fast, with powerful biologics, sometimes combined with other drugs, to get the patient into remission quickly. And, this is key, to avoid the long-term dangers of steroids.
So, what are all these drugs we're talking about? Well, let's picture the options as a pyramid. We'll start with the foundational treatments for mild disease at the base and build our way up to the most advanced therapies for severe cases, right at the peak.
So, right at the very bottom of our pyramid, we have mesalamine.
This is the go-to drug for mild IBD. And what's really clever about it is that it acts topically. It's not a systemic drug. It works directly on the inflamed surface of the gut to calm things down. It's kind of like applying a soothing cream, but on the inside.
Moving up a level, we've got corticosteroids, like prednisone. Think of these as the emergency fire extinguishers. They are incredibly good at shutting down the inflammation during a bad flare-up and getting a patient into remission. But they come with a huge catch.
And this is exactly why you can't stay on them long term. The side effects are just awful. Everything from depression and fluid retention to cataracts, osteoporosis, and even the death of bone tissue in your hips. They are a short-term bridge to get you out of trouble, not a long-term solution.
And that is where immunomodulators come in. These are known as steroid-sparing drugs. They work by tamping down the entire overactive immune system, which lets doctors get patients off those nasty steroids while still keeping the disease under control. It's a much more powerful body-wide approach.
And right at the very top of the pyramid, you find the biologics, specifically anti-TNF drugs. And these are a huge leap forward. Instead of just suppressing the whole immune system, these are like guided missiles. They're designed to target and neutralize one very specific protein, TNF, which is a major driver of inflammation in IBD.
But guess what? The story doesn't end there. The evolution of IBD therapy is this constant quest for a better balance, for drugs that aren't just powerful, but are also incredibly precise, so they minimize risks by only acting where they're needed most. This brings us to the next generation of biologics, anti-integrin therapy. And the way these work is just fascinating. They essentially act like a bouncer at a club. They create a roadblock that stops the inflammatory white blood cells from ever leaving the bloodstream to get into the gut tissue and cause all that damage.
And this comparison just perfectly shows why that precision matters so much. The first-generation drug, natalizumab, worked pretty well, but it blocked immune cells from getting to both the gut and the brain. And that, unfortunately, opened the door to a rare but absolutely devastating brain infection called PML. But the second-generation drug, vedolizumab, is gut-selective. It only puts up the roadblock at the GI tract, which makes it dramatically safer.
And you don't have to take my word for it. This quote from the source material says it all, doesn't it? The arrival of a more targeted, safer drug didn't just add another option to the list, it completely changed the standard of care. This is modern medicine in action. This relentless push for not just effectiveness, but also safety through precision.
So given how sick he was, Alex's doctors chose that top-down approach with one of these newer, gut-selective biologists, and it put his Crohn's into remission. His story just highlights the incredible progress we've made, but it also leaves us with this final, big question. As these treatments become almost like science fiction in how precise they are, the central challenge is still there. How do we balance these amazing benefits against the potential long-term risks of tweaking our immune system, risks we might not even understand yet? It's the new frontier of medicine, and it's a question we're all going to be grappling with for years to come.